Let's talk about IVF, let's talk about infertility. And if you're an African, you understand that infertility is heavily stigmatized. People see childbearing as a very important part of marriage. It comes with a lot of challenges, financial challenges, social challenges, mental issues. And I decided that there is no better person to invite today to talk to you about infertility other than my guest. So let me introduce my guest. She's already in the house and I'll be bringing her up very soon. Her name is Dr. Mojisola Aderonmu. She's a consultant obstetrician and gynecologist. She has a strong passion for maternal health, ultrasonography, and infertility management. She obtained her MBBS degree from the University of Lagos in 2008. She completed her residency training in Lagos University Teaching Hospital in 2018. She holds fellowship from the West African College of Surgeons and the National Postgraduate Medical College of Nigeria. She's actively involved in advocacy for women and girls. She serves as the executive director of the Amira Feintola Foundation that provides scholarship to deserving students. She has several publications in reputable journals and she has presented at international conferences, including the Royal College of Obstetrician and Gynaecologist Conference in Birmingham and the IFFS Conference in Athens. She's a member of the Nigerian Medical Association and the Society of Obstetrics and Gynecology. She has held various leadership roles and she currently serves as the medical director at the Medical Arts Center, Ikeja, Lagos. Ladies and gentlemen, help me welcome again on this platform. She's been here before, I think over a year ago. Please help me welcome Dr. Mojisola Aderonmu. Good evening, Ma.
Pleasure to be here. Mhm.
Thank you so much. Happy Sunday to you and happy new month.
And to you as well.
So
It's
before we
good.
start, I want to ask you, Ma, how have you been? How has been work and family?
We're all fine. Work is good. Family is good. Everybody's doing well.
Sometime ago, I think I saw your upload. You traveled abroad. I think maybe you went to Flex or you went for conference. Which of them?
Collabo, na collabo.
Well done, Ma. So without wasting time, I have a lot of people watching us already. There is this comment about infertility. Sometimes people don't like using that word. Sometimes we come across that word infertile. So when we say someone or a couple is going through infertility or is having infertility, what exactly are we talking about?
So it means that the couple have been trying for at least 1 year. They've been trying. So, yes, you're correct when you say people don't like hearing the word infertility. So, you hear things like TTC, trying to conceive. Yes, so they've been trying to conceive for at least 1 year and they've been
Okay.
having regular, unprotected sexual intercourse. And when we say
Hmm.
regular, we mean 3 to 4 times a week. And when we say unprotected sexual intercourse, it means that the couple are not using any form of contraception and are not using any method or substance or product that will interfere with getting pregnant. So if a couple have been doing that for 12 full months and they still are not yet pregnant, then we can say yes, they have some problem with fertility.
Okay. A couple just newly got married and 6 months, no pregnancy. The woman is already panicking and she says, Doctor, they say I'm having infertility. Can you please speak to her to correct that her desperation and her panicking? Because I see this a lot. Doctor, I'm trying to conceive. When did you get married? 6 months ago. Nothing is happening. I think we need medication. Do they fit in that definition?
So there are caveats to the definition I gave you. And when
Okay.
women are 35 years and over, usually by 6 months, we can begin to evaluate them, check what they are doing. Are they doing the right thing?
Okay.
Also, for a couple in which either of them have any reason in their medical history that would
Mm-hmm.
suggest getting pregnant will be difficult. So, for example, if they've had surgeries that compromise their reproductive, potential, if they've had
Mm-hmm.
cancer treatment, they won't be waiting for 1 year because they already know that there's a reason why getting pregnant may be difficult. Yeah, so, but for people who don't have any history suggestive of problems trying to conceive, we usually advise they wait for 1 year. They've done the regular unprotected sexual intercourse, and if nothing is happening, then they can come in for an evaluation.
Okay. There's this comment I get: no pregnancy, village people. No pregnancy, village people. But I know that there are causes of infertility on the woman and on the man. Before we
Yeah.
start talking about IVF at all, what are those things, especially in this present day and time where it's now so common? I don't know why, but a lot of people are having this challenge. What are those things that can put a man or a woman at risk of having infertility?
Yeah, that's correct. Infertility can be either due to the man or to the woman, and sometimes to both of them, where we say combined causes.
Mm,
On the part of the man, the usual thing we evaluate is the semen analysis. So we
mm,
evaluate the seminal fluid analysis. We look at the total count, that's the number of sperm
mhm.
cells that ejaculate. We look at the morphology. How many of those sperm cells look normal? There's a
Wow.
way there's a way a normal sperm cell will look with the head, with the neck, with the tailpiece. How many of that look normal? And then movement, because you need the sperm to swim up the female reproductive tract system to get to the egg that has been released. And we call
Mhm.
that motility. So when we look at those three parameters, if the parameters fall below what the minimum should be based on the WHO standard, then we can begin to evaluate further. We can begin to, look at what else could be responsible. Any medical history, any drug history, environmental causes as well, lifestyle these days. Yes, so those are things that can impact on the semen parameters. On the part of the woman, the woman has a more complex body system, I believe. So we'll be
Yeah.
looking at the ovulation. If a woman is not releasing the egg, it doesn't matter if she's having sex. If there's no egg being released, then pregnancy can't occur. So ovulation, and there are different things that can affect the ovulation. Either the
Okay.
egg depleted, faster than they should, in which case we are talking about premature ovarian insufficiency, or it could be that the woman has polycystic ovarian syndrome. So there are so many follicles, but they are not growing at a predictable pattern, talk less of ovulating at a predictable pattern. That can affect her chances of getting pregnant. Then we can also have, factors like the tubes, tubal factor, because the sperm needs to swim through the tubes to be able to get to the egg that has been released. Now, if that tube is damaged or blocked, there's no way the sperm will get to where it should get to. And fertilization of that egg leading to an embryo cannot get back into the womb itself. And common things that cause tubal factor is infections, sexually transmitted infections that ascend up the genital tracts, chlamydia, gonorrhea, all of that. Also, there's a uterine factor, the uterus itself. So women with African descent, Africans, Afro Caribbeans usually have a higher predisposition to uterine fibroids than Caucasians. It's just the way we are. It's not anything, at least in the books, it's not anything we
Mm-hmm.
are eating or any water we are drinking. It's just the way we are. But some women now let the fibroids, grow so huge.
Mm-hmm.
They change the size, they change the appearance, they change the nature of the uterus. They occur in places, especially under the womb lining, where it will impede a successful attachment of an embryo. So that's
Mm.
one of also something like Asherman syndrome, where there's been repeated evacuation or curating of the womb itself. It can damage that womb lining, and then the lining begins to stick together, making it difficult for fertilization and implantation to occur. Endometriosis is also something that can cause, infertility, because by virtue of it occurring in different places, it elaborates the same response that the womb lining will do. And so with those
Mm-hmm.
bleeds in all those places, it irritates those areas, causes adhesions. Those adhesions can even bind down the ovary, the tubes, make them not able to function in the way they were designed to function to ensure that fertilization occurs. So those are some
Mm.
of the things that can lead to infertility.
Is there a possibility that the man is fine, the woman is fine, but they have done every check? Man is okay, doctor, no problem. My wife is fine, no issue. But yes, no pregnancy. Is there a case like that?
Yes, so it falls in the 1% where we say unexplained infertility. And the way I explain it to patients that I come across with that is that we can only test for what we are able to test for now. So, um, when we used to have, initially, before we diagnose malaria, you do thin film, thick film, under microscopy, and all of that. These days, we just do a spot check,
Yeah,
and
random,
you're the malaria antibody. So
rapid,
things
yeah.
have improved, yes. So the more technology improves, the more likely we will find the reason for the unexplained people. So there has to be an explanation. It's just that we are not yet at that level to know what it is.
What it
Yes,
is.
that's
Well,
that's how
yeah.
I can.
If you know anybody that might benefit from this discussion, please share now. Now, share. There are many management or treatment options for couples going through infertility. And one of them, most times, people don't like talking about it, but we are now having more discussion on this, is IVF. So I want you, Ma, to help us. Tell us, what is IVF all about? Somebody is having difficulty conceiving and then has heard IVF on one or two occasions, but really does not understand what this means. Can you help us break it down?
Okay, so IVF is science that models what happens in the natural. So for those who have natural conception, who get pregnant naturally, who, the husband met the wife, they had sex, and then, the woman gets pregnant. It means that at the time where they had sex, the woman ovulated. At the time when they had sex, the sperm parameters of the man were also of good quality. They were able to swim up the genital tract of the woman. They were able to swim up through the vagina, the cervix, the uterus, the tubes, get to the egg that was released, fertilize it, and it became an embryo, and the tubes swept it back into the womb. It arrived in the womb, it attached to the lining of the womb and embedded itself. And then 2 weeks, roughly thereabouts, the woman didn't get her period. And then she waited a few more days, did a test, and she found that she's pregnant.
Mhm.
IVF just mimics that. So IVF mimics growing the egg in the woman using injections and other medications we use. Then it collects the egg from the woman in theatre under anesthesia, and then it collects the sperm. The man gives us a semen sample, or we can extract the sperm from the testicles, the scrotum if possible. We use that sperm to fertilize that egg. We put it in an incubator. We allow the cells to divide. We provide the right temperature, nutrients, and all of that. When we see that it is dividing by day 5, we then put it back in a very tiny, rubber silicone catheter, and then put that catheter back into the womb that's through the vagina, the cervix, and we deposit that embryo. We allow it to attach, to implant, and then we test roughly 2 weeks and see
Okay.
that it work, did it not work. So IVF just mimics what happens in the natural. And it is not every couple who
Mm,
have a challenge getting pregnant that have to end up at IVF. There are several steps before getting to that. So maybe people just see IVF as being, you know, going to space. I don't know, but it doesn't have to be like that. At least before we go to space, we'll ride inside vehicle, we'll ride inside truck, we'll do aeroplane before we get to space. Exactly.
People say babies deliver through IVF every time artificial. I like my stuff natural. Artificial babies, these babies are not real. Why would you be doing things like that? I don't know if you also come across such comments.
So yes, I have. Well, having been a doctor for so long, you get to hear some of the things that people think in their head.
Hmm. Hmm.
Um, there's nothing wrong with children conceived from IVF. So far, science has looked at it. Louise Brown, the first IVF baby, is in her 40s. She's
Mm-hmm.
perfect normal. I don't think anybody has seen her on any of the pictures where she has two heads, three ears, two or three nostrils. She looks just like us. She speaks just like us. There's nothing unusual about her. She doesn't look like an alien. So for people who say, oh, they look a different way, I try to find out, is there anyone you've seen that looks a different way? IVF doesn't create human beings that are a separate species. They are still Homo sapiens, just like us. So there's no difference in IVF babies. Yeah.
Thank you for that. There's no difference in IVF babies. You mentioned something before this last response about not everybody will just wake up and say, and I want to go for IVF. So at what point in time should a couple trying to conceive now consider IVF in this journey? It's a very long journey for the few people I have come across. It's not something sweet at all. So at what point in time in this whole process of trying to conceive would you say now you are now qualified for IVF?
So it depends on how early they seek, help. It depends on
Mm,
how early they seek help. Depends on how early they go for evaluation, how thorough the evaluation is. So for example, for someone who has just one fibroid under the womb lining, you can
mm-hmm,
do surgery or do any other of the non-surgical procedures that can address that. That takes out that issue, and they go on to have babies. For someone who is not ovulating regularly, they can go on medications to ensure they ovulate, and then of course, they have to do tracking, follow-ups, and all of that, and they go on to have babies. So not everybody, because if they're at a stage where ovulation induction can address the problem, or surgery can address the problem, they may not necessarily have to come in for IVF. For some people, they may just stay on supplements, they may change their lifestyle, the sperm parameters improve. I know I've had a number of patients like that. They've come in for the evaluation and we say, okay, sir, your numbers are not so great. How about you stay on these supplements, and let's see you in 2 3 months. And then they don't come back, and then you just say, oh, I'm just checking on you, and they're like, ah, well, we don't really need you anymore, God has done it. So yes, that's also part of our joy. So it's not always that couples who have challenges must have IVF. No, there are
mm.
things, several other things they can do before getting to IVF.
Before getting to IVF. Now, this couple, I believe in what God cannot do does not exist. I believe in that. I believe so much in that. But right now, this man and his wife, they have tried every means, and it's clear to them that they might end up with IVF for whatever reason. Maybe I know someone who contacted me. The person stays abroad. They want to come back to Nigeria for IVF. So how should they prepare for IVF physically, mentally, financially, even for the woman? I saw a lady who was trying to go for the process. She was crying because she said she would have to take so many injections and medication. So how should they prepare for IVF?
Yeah, so the mental part is very important, and especially in this day and age where we practice medicine, people are more aware. People are
Mm-hmm.
have more insight into mental health, their mental resilience, what they can handle, what they feel they can't, and so by speaking up about it, they can also get help. One of the core principles, one of the underlying arms of IVF treatment is counseling, the psychological assessments, and then also providing help for the couple who are seeking IVF, because IVF doesn't work always the first time. For some people, they need to do more than one, more than two
Mm.
cycles, and that's the truth. And when they say why this is supposed to be the magic pill, I tell them that if
Mm.
every young fertile couple have sex every month, we'll be more than 8 billion in the world.
Mm.
If every cycle is producing a pregnancy, we'll be more than
Mm.
8 billion. So even when in the natural everything is fine, it still
Mm.
doesn't mean that that cycle will lead to a pregnancy. And that's why the definition says 12 months. It means that if every month, they've had sex enough, there will be a month in that 12 months that they will get pregnant. And so IVF may not work the first time. It may not work the second time, even when the evaluation is clean. That means you've tested for everything, you've ensured everything is top notch. And so that psychological support and insight is helpful to the couple, because it also helps them count the cost. I always tell people the money part is the minimal part of it,
Mm.
but the
Mm.
resilience to say that this thing can work, even if it didn't work the first time, I will try it again and it will work. That is the part that you can't take away. You can't buy it. You can't infuse it into the person. You have to help the person, you know, create it on the inside of them. That's the mental part. The financial part, yes, IVF is expensive. And people abroad are coming back because when they look at the equivalent, when they look at the equivalent in Naira, they know that IVF is cheap, is way, way cheaper
Mm.
than what they have to pay if they were doing that abroad. So for some of them, that's a big game changer, because even when they add the money for their flights, Airbnb, the cost of the IVF, they still have a lot saved compared to what they would shell out in countries where they have to pay out of pocket for it. So that is one part to it. There are in Nigeria there are avenues to source. Either pay out of pocket or friends contribute, families contribute. I've had patients, that this one is family contribution. I've had patients that Oloriebi will follow them to every consultation because everybody contributed for it and they must give account. So yes, we have that, and we do realize the importance of that. And it's also because the family structure, the societal structure places a premium on saying, if this our family member has this problem, if they
Yes.
can't solve it themselves, we will all come together and help them solve it. At least we must try to solve it, even if we cannot miraculously give them the answer they want. So and that says a lot to what is possible in terms of funding. I know there are financial institutions that do, have some sort of health loans, health access for loans for that. People can also look into that part of it. In terms of the couple themselves preparing,
Mm-hmm.
what the first thing on the list is lifestyle change. You can't be doing smoking, shisha, alcohol, everything, and expect that your sperm parameters will be great. It doesn't always work like that. Yes, there are some people that still have, good parameters, but by the time infertility is an issue,
Mm-hmm.
that life has to be cleaned up. That lifestyle has to change so that all the toxins, the radicals that are being produced within the body can go. and the cells themselves have enough nutrients, oxygenation, and all of that to be healthy, so that that can improve the chances. Um, Eating healthy, cut out alcohol, smoking, and all the other substances that shouldn't wouldn't add any value to the body. Healthy weights. So both for men and for women, actually, healthy weights. For women who are even on the big side, have polycystic ovaries, when they lose up to 10%, their ovulation actually can just restart by itself without them necessarily having to go on anything, from outside, any medications and all of that. So healthy weights, both for the men and for the women, is very important. When they do that, they are on the first step to committing to a successful IVF treatment. The
Hmm.
first step is that, yeah.
The first, this thing you just mentioned concerning lifestyle and weight, I am a huge advocate for lifestyle because I
Yes.
hear people say, doctor, in the, they'll tell you in the olden days, our forefathers this, our forefathers that. But our forefathers were not living this careless. I don't know. They were not having some kind of lifestyle that we have. You can't even see young people walk again. It looks like I
Mm,
just have to bus, take a ride. I can't stress myself. But in the olden days, our forefathers were working, and that's why you can see a 90-year-old woman in the village, a 100-old still going to the farm, but it's difficult to find them right now. So this will lead me to my next question. Is there any, before we talk about the process, is there any age limit for IVF? A woman has been trying, has been
yeah.
praying. She say, I believe in miracles, but it's not coming. And now is now 40, going to 50. Is there any age limit for IVF?
Mm. Okay, so that's a very layered question. I'll just try and I'll try to answer it as best as I can.
Okay.
For women, the reproductive age range is from 15 to 49. So that's when follicles are healthy, there are a good quantity of them, and
Mm-hmm.
there shouldn't be any problem getting pregnant. So for most women, they'll naturally finish their education, get married, start having children within that age group. Now,
Mm-hmm.
as women grow older, the quality and the quantity of the oocytes they have in their ovaries begins to decline. And so,
Hmm.
if a woman is, 35, 36, and she doesn't see herself settling down, you
Mm-hmm.
know, soon before 40, I advise that they freeze their eggs. So they'll do the IVF process, collect the eggs, and freeze it. They won't go the whole route of creating an embryo.
Why is that
So they'll
important?
so you need the sperm to create the embryo,
Mm-hmm.
and they don't have a sperm source because
Yeah.
they don't have the person they want to settle with or raise children or share
Yeah.
children with yet. And when they retrieve and freeze, even if they're already at 50, they have their own genetic eggs to use. A good example is there's this actress who had a baby. Was it an actress or a model? Her name is not coming to my head right now, but she did that when she was much younger, and she was having her baby at 50. So she had frozen her eggs way earlier. She had
Mm-hmm.
she had good quantity. At the age where she most likely had her eggs, frozen, she wasn't thinking of, trisomy this or trisomy that, because she was still way much younger. So she had time on her side to create quality and quantity oocytes that she could freeze. So for
Mm.
women who are in that space, they don't have the time yet, they don't have the person yet, or they are not sure that person is who they want to raise children with, they can freeze their eggs. And when they are sure of what they want to do, they can always come back. We thaw those eggs, fertilize with the sperm of the man that they are now sure of, create the embryos, and they go on to have embryo transfer, pregnancy, and they can have their children. That's something they can do. In Nigeria, we have the Association of Fertility and Reproductive Health, that's AFRH, and that helps us self-regulate for all of us in the fertility space. So we have guidelines that say you can't put an embryo in a woman who is older than 54 years old. And that is based on the fact that the older women get, one, the more likely they have, associated illnesses, hypertension, diabetes, heart issues, and all of that. And if we go back to the principles of medicine, first do no
Mm-hmm.
harm. So
Mm,
if you are doing first do no harm, and you know that pregnancy itself is a stressor, it's not a disease, yes, but it's a stressor. Most times it worsens some of these medical conditions, makes it
mm,
sometimes can make it really life threatening. So yes, we don't do embryo transfers into women older than 54.
mm-hmm.
Now, if a woman had frozen eggs when she was 30 and she's 54 and says, okay, well, now I can't, do my or carry my own baby. Yes, she can then, ask to do a surrogacy where somebody else who is younger can then carry her genetic baby for her. Yes, but most times a woman who has frozen her eggs will know that time is ticking. She won't wait until 54 before coming back to try and carry her baby herself. So those guidelines helps us know who qualifies for an embryo transfer in a safe manner without jeopardizing their health. And then what type of treatments can you do while waiting? So the guidelines are there to help us make good decisions when it comes to patient care. Yeah.
Thank you very much, Ma. If you are
Yeah.
gaining value, do me a favor. Subscribe if you know you've not subscribed, or follow and share so that more people would gain. Somebody is saying something. Said nobody told me I could freeze my egg. Another person is saying, what do you really mean by freezing the egg? Because I see people right now, like this is the first time they are hearing the word I could actually freeze my egg. Could you just help us break it down?
Okay, so with the IVF process, we give medications to the woman to make the ovaries produce eggs, and then we collect those eggs under anesthesia in theater. And then those eggs, when we collect them, we can preserve them. So the process, the way I can explain it is freezing. So you cryopreserve it using liquid nitrogen, and that halts the metabolism of the eggs. You can keep it for up to 10 years. Yes. And then when you are ready to use it, just like if you put your food in the freezer, it's cold. If you want to eat it, you bring it out, you allow it
Mm,
to ahead
mm.
before you can eat it exactly. So when you are ready to use that egg, we thaw it and then go on the rest of the process of fertilization, incubation and all of that. So that's just what it means.
Okay.
Yes, some people say nobody told me. It may be
Mm-hmm.
that they didn't know about it. It may just be they didn't know about it. The more we know, the more we can put out that knowledge. There was a time when people didn't know anything about contraception. So even though they didn't want more children, they just didn't know how not to have more children. Or even if they wanted to space, they just didn't know how not to, get pregnant back to back to back like that. So it's the knowledge, and it depends on who is within your circle, who is within your space that knows about it. So I'm sure it wasn't intentional for whoever asked the question.
Ma, is there any side effects associated with IVF? I know because I see people. I am every day. I'm teaching on social media. I see some ladies abroad. They are scared for going through this process, so they want to know. Even their partners are concerned. Is there any challenge? Will she come down with any problem? All the whole injections and the pills that she would take, would it give her any problems later in the future?
So with fertility treatments, there's daily injections, regular, scan appointments, regular health, checkup with the health facility looking after you. Um, Pain at the injection site is almost a given, and the process has simplified. So now most of the injections will come with very tiny needle gauge. so that it can enter the skin without causing discomfort, not the very fat, needle gauges. So the manufacturing and production side is also taking feedback from patient experience to say, oh, if I have to take 10 injections, why must
Mm-hmm.
it be so fat that it looks as if I'm sticking myself with, a straw or something? So tiny injection needle so that the pain at injection site is less. Sometimes people have reactions to that injection area. Not then, because most of medications are hormones, they are hormonal.
Mm-hmm.
Definitely some symptoms, some side effects will come up. Nausea, vomiting, lightheadedness, all those ones are what we would see in women who, if they were going through their natural cycle, they would have that. Headaches. So for some of them, once we explain to them that look, it's not unusual. You can have headaches, you can use paracetamol, you can, have pain at the injection site, you can make sure you put a cold compress on it to ease the discomfort. Yes, so those are some of the things. There's no long-term effect because those hormones have a washout period. They are supposed to increase, wane, and then go like that. So it's not like because I did IVF in 2023, that's why today in 2025 I have something growing in one side of my head. No, it's not like that. The 2023 has gone long ago. Yeah,
Long ago.
yeah.
Okay, before I ask my next question, I know I have a lot of doctors watching this program. A lot of them have been here. I want to use this opportunity again to say thank you to every doctor that has been here to share knowledge. I don't take it for granted at all. I'm sincerely grateful. Somebody's talking about the price. Doctor, no be small money be this thing. This IVF wey you dey talk now, I no think whether I fit do am. My pikin, help me. You mentioned freezing, doctor. That freezing too is not cheap. So briefly, ma, what should anybody considering IVF have at the back of their mind financially, especially for even those who are abroad that want to come back? What should they look at? I'm not, maybe you might not get an exact amount, but what would be the whole range?
Hmm. That's usually a tough question because
Hmm.
prices will differ. But if I'm speaking to you in reality, knowing what goes into doing an IVF procedure, it's not likely for you to get an IVF less than 1 million naira. It's not possible based on the medications you are going to use, unless you be doing remedication today, placebo tomorrow, remedication tomorrow, which that is not IVF. So
Hmm.
there's not likely to be anything less than 1 million. And depending on the type of IVF that the person is doing, are they using their own gametes? Are they using donor gametes? Are they doing surrogacy? All of that in the mix. How many cycles they may do. Some clinics offer a rebate or a discount if the client or couple have to do more than one cycle. Some people will say, okay, maybe like, how we go to the market and we say, okay, if one is 1.5, can't I buy two for, uh,
Cost.
yeah, exactly. So, yeah, some people can, try and do that depending on how the clinic structure is in terms of, payment. Um, it's in millions of naira. There's no way around that. And one of the things that also is a factor for it is quite a number of things we use in the fertility space are not produced in Nigeria. And so
Hmm.
definitely they are going to be subject to what you purchase, how much you're able to purchase it, how much you're able to clear it, how much you're able to, use, how much it ends up being from the manufacturer to you, before you can work out your prices. So things like media, medications, those are not produced locally. So they are subject to price, forex, and all of that here. So I think that's the safest answer I can give.
So for you thinking about the course, I believe you've heard before. I talk about how to contact you because I know this is what you do, ma. But what is the success rate of IVF? Somebody says, I beg. I know somebody who did IVF one, two, three, work. You have an association, and based on the data available, what is the
Yeah.
success rate for IVF that
No,
can encourage our people?
yeah, acceptable rate is 40%. That means 4 out of 10. And that
Hmm.
and that does not mean that if it failed, if the person was in 60% the first time they tried and it failed, that they can't get pregnant. No, it doesn't. And that's
Hmm.
one of the key things in how thorough the evaluation has to be. You know, you
Hmm.
don't you don't just get up from home and say, "Oh, I'm going to Kilimanjaro mountain," without knowing how much it will get you there, whether you need to pack extra clothing, all those things. All that evaluation is very important so that the first trial really has the highest rate of success. Unless there was anything that came up, you know, un, unaccounted for, unanticipated.
Hmm.
The most fertility practitioners will ensure that the evaluation is thorough so that the success rate is higher. And they will actually tell you. So one of the things I have struggled with the most is,
Mhm.
telling patients they need donor gametes, and they say no, I want to try, and I
Ma,
let them.
when you say donor gamete for
Yes,
anybody, what
donor egg or
do
donor
we
sperm.
mean? Okay,
Yes,
that is not from the man or woman, but for someone
yes,
else.
from someone else who is anonymously donating, and they say no, I want to try, I want to try. I let them know that I'm not trying to take away your right to try, but I have to let you know what
Hmm.
will give you the highest chance of success.
Hmm.
I don't know if you get me. So it's not that they cannot try. If the reason they came is to try, that's fine. But if
Hmm.
the reason they came is to succeed, I have a responsibility to tell them what can make them succeed. So at that point, and this is why it is not a one appointment is where you get all the answers. No, sometimes the couple have to go back home and think about it, discuss about it, agree on what they think is the best option for them. And as long as it will not harm them, and as long as it is not unethical, the doctor will try. The doctor will try.
And this one now, I remember this one. Is it possible that there are people who are not licensed to operate in this space, carrying out procedures on IVF or for IVF on people? Are there people around that the listeners should be careful? The reason this one because somebody met me, doctor. I have spent. I said, where did you go? I said, I beg, my hand no day. So are there people like that? Have you heard stories like that?
Yes, yes. And yes, I have heard stories like that. But you see, what I tell the clients who come with those stories is this: it's your responsibility as the person seeking care to ask questions.
Hmm.
When somebody says, "I'm Dr. Aderonmu, I'm doing IVF," that's not the answer. The answer is in what you read before you started. Where did I go
Hmm.
to medical school? Where did I do my training? What
Hmm.
certification do I have? That is the answer.
Hmm.
So anybody who just says, "Oh, I'm doing IVF," you are going to pay the person money. It's not free. So yes,
Mm-hmm.
you should. Okay, how long have you been doing IVF? Where did you learn it from? Why did you? But I think it's a cultural thing. Most people just say, "Ah, if the other person said they got pregnant there, let me just go. Let me not ask too many questions so that I'll not annoy the person. No, let me not
Hmm.
know. That's not how it is. It's within your right as a patient. It's within your rights as a consumer of the service to ask for those questions. And yes, That's why we have, councils regulating the practice of licensed practitioners. And then we have the police who will now go after the unlicensed practitioners, and then the law can take its course. So yes, there are places like that. It's just like mechanic. Everybody will say, I'm a mechanic, but if you give the person your car and it comes back wrong, then that's not when you now be asking that, this your own mechanic, why did you put the engine in the boot and you put the boot
Mm,
on top of the car, So yeah, there are people like that. People should ask questions. They should find out what councils, what regulations, what certifications before they commit to it. Before they commit
yeah,
to it.
because that is money. Before you let go of such huge amount of money, Ma,
Out
you
of it.
mentioned you mentioned gametes. Some people are confused. Why would you say that instead of using my own sperm or my egg, why should I be using someone else's sperm or someone else's egg when I came for the IVF and I've been told IVF is for me? So why now should we now go use someone own instead of mine?
So there gets to a point in time where what the person needs to achieve pregnancy, they no longer have it. So a woman who is coming in at 59, 60, she's been menopausal for, let's assume, 5 to 10 years. Her hormone levels have shown that she's menopausal. That means there's no follicle, nothing left in the ovaries that will grow to give an egg that can be ovulated or retrieved. If she wants children, within the regulations on ground, we can't use her eggs. She'll most likely need donor eggs from a younger person who says, oh, well, I hear that there are people who are unable to have children. They need, eggs to be able to do their IVF. And I've had my own children, or I'm yet to have my children, and I have, plans to do it, that. I would like to donate. Yes, they can donate to such people. They can donate their eggs to them. Sperm, there are men who their sperm parameters are azoospermia, that is no sperm. It's not obstructive. We've already checked their hormone levels, we've checked the scan, we've seen that the testes are no longer producing sperm. They may need donor sperm from men who are healthy, who have the intention to donate anonymously. They are not, and donors are not looking for parental rights. By virtue of their voluntary donation, are waiving every parental right to any child or children conceived through through the IVF, using their gametes, using their egg or their sperm. So that helps people to have their own children. When patients ask me how, I ask them that in the sense of transplant, if somebody can give a particular organ to somebody else to have
Mm,
to continue their life, if we
mm,
are not castigating the recipient of the transplant, that's how, why did you need somebody else's kidney? Why didn't you use your own very well? I don't think we also have any right to castigate people who have realized that they don't have their own to use and are willing to accept, donation from other people, adults, consenting adults with informed consent, not
mm,
under any coercion or
mm.
under any, any dark side to it. No. Informed voluntary donation by adults who want to donate their eggs or their sperm. Yeah.
I like the fact you mentioned adult consenting adult because of recent there has been conversation about young girls either they sell their eggs or they steal their eggs whatever way. I would want you, ma. I have a lot of young ladies listening to me online and offline. I want you, ma, to speak to them with regarding this whole unconsenting stuff, involuntary stuff, the unethical garment stealing or garment donation. I want you to speak to them on this.
So ethics is a very, very, very important part of medicine, of life, and especially in fertility practice. Because at every point in time, you have to weigh those decisions against the four principles of the ethics: autonomy, which is very important, justice, which is very important. You have to be able to say, this person, are
Mm-hmm.
they are they able to consent to the procedure medically and legally? Medically, in the terms that they are not having any organic brain disease, they are not under any influence of any medications, they are actually within their right senses. And then according to the law, are they old enough according to the law to take that decision? If we cannot let people younger than 18 vote or have a driver's license, we don't have any business asking those kind of people, what would you like to do with your egg? That's not a question for someone like that. That's a question for an adult who is able to listen to what it entails, explain back to you that this process you say I will undergo, this is what I understand by it. This is what I understand by the risk involved in it. This is what I understand by the benefits to the society about it. And yes, I am willing to do this, or I am not willing to do this. Or even if they initially accept, they can say, oh, well, I changed my mind because of this. That is an adult who is able to use the information given and then retain it and then give an answer. That is the informed consent part. So, and another part of it is that the focus ethically shouldn't be on money.
Mm.
The focus should be on helping people, because there's really no amount of money that you can put on a human life. There's no amount of money. So most of what is paid is remuneration for inconvenience. It's not a
Mm.
product. It's not a product that, okay, I went to the market and I bought one plate of rice. No, it's not like that. Yeah.
Okay, ma, for somebody listening and the person says, I want to reach out, I want to contact you, how can we are almost out of time? How can they do so?
They can walk into Medical Arts Center. We are located on Mobolaji Bank Anthony Way, 21 Mobolaji Bank Anthony Way, just across from the Army Barracks. Yeah. They can find us on Instagram, Medical Arts Center. They can find us on Facebook, Medical Arts Center. Yeah.
So you had Medical Arts Center on Instagram, Medical Arts Center on Facebook, so that you get the address and then you reach out to the facility and get your questions and your concerns attended to. Finally, or I don't know, for a couple now thinking about this, what would you advise them? What would you want the man to know? What would you want the woman to know based on experiences thus far?
Um, Take a jump of faith. The most is that you will have an answer to why you don't yet have, your baby. And the best is that you can actually have babies through IVF. We've had couples come in and do one cycle, have a lot of embryos, and they go on to have all their children over the next 10 years from that. So it's an answer. And I always tell people that it's God's way of making sure that people don't suffer. 70 years ago, many people would die childless. IVF has made it possible for millions of babies to be born, to bring joy to families all over the world, whether in Japan, in China, in Nigeria. And so we're definitely doing something right. Yes, as time goes on, we need to refine it, we need to add more rules, we need to make it better for our societies all over the world, all over the world. But then, for any couple considering IVF, you can actually have your babies with IVF. And even when people say, oh, God did it, please ask them how God did it, because I have a number of patients. That they only say God did it. They will not tell the in the testimony, they will not add they came to my clinic oh, or they came and sat the opposite me in consultation. So please, when they say God did it, ask how did God do it? Did an angel come, or did you end up doing IVF? It's still God that did it. But let them tell you how God did it. So you
Is
won't
it is it Ma, is it because of maybe is it stigma? I don't know, or misconception or whatever. This is common. Somebody has been looking for a child for 10 years and now they are pregnant. Ah, we thank God though. And then people listening to them in church will be like, let me also wait on God for 10 years. Not knowing that they prayed and God spoke to them, take this money, go for IVF. So why
yes.
is this always happening? Why this whole misconception, stigma, and why?
It's really hard because we have patients, clients, successful, and we ask them, oh, could you let us do a short video about you? Let us to encourage people to be like, "Ah, no, no, no. That the testimony they shared is that God did it now. That how we will now put that they came to our clinic." So we'll be like, okay, no problem. And then we wait for the next person who is able to. So it may be that society still has a lot to do in
Hmm.
being open about the truth. And one of the things I said is this: every time we peel off a layer, we have more light. In the periods where child abuse was rampant, it's because people were hiding it. But these
Hmm.
days, we're having conversations with children and saying, don't let anybody do this to you. Don't let anybody touch you this way. Don't. So it has pulled the wool off many people's eyes to say, even if they are not related to the child and they are seeing it in the periphery of their vision, they are like, no, this is not right, because there's a lot of information. When HIV first came out, people will run away from anybody with diagnosis and say, don't sit near them, don't shake their hand, don't hug them. But these days, we've destigmatized it to the level where it's just like using a blood pressure pill or using a diabetes medication, and then they go on to have good life. So IVF shouldn't be hidden. It can help people. In fact, if people heard about it earlier, they may
Hmm.
still be within the age when they can do their own treatment, not needing donor. Not that they are coming when they're in their 60s, when it's almost like, okay, we just want to have the child, even if we can't have it the way we would have wanted to. So let's be open about our testimonies. Yeah, let's be open about it. Let's encourage people. There's nothing wrong with IVF babies. When my babies come to greet me, when they come to greet the team, we're always excited. None of them has any deformity, and especially for those abroad, they come in and they are speaking spree, and you're like, oh wow. So yeah, so please, there's nothing to hide. The babies are normal. The families should be proud that God has answered their prayers using IVF.
Thank you, Ma. We have to draw the curtain here. I am grateful for what you're doing. I'm grateful for the knowledge, for the time, for the energy, and also making out your little that small time for us to come and share for people that need this. Like, because it's painful. Oh, it's painful. You just sleep with your wife carry belle. You don't know what God has done for you. It's difficult for some people, and that is why this program would help somebody. So help me share. And once again, you can reach out to Medical Arts Center on Facebook, on Instagram, right? Medical
Yes.
Arts Center. Thank you very much, Ma.
Thank you for
Care.
having me once again. It's always amazing to chat with you. And
Thank
well done
you.
for